Hi there, my name is Sedona Sweeney, and I'm an assistant professor in health economics at the London School of Hygiene and Tropical Medicine. And today I'm presenting a bit of quick analysis we did looking at the equity impact of COVID lockdowns in 6 countries. So in the early stages of the COVID pandemic, many countries around the world enforced national lockdowns, including a range of policies such as school closures, curfews, business closures, and requirements to work from home. Although these policies have largely saved lives, there's also concerns that lockdowns could have increased economic insecurity, particularly for the most vulnerable. We undertook this work aiming to understand the impact of national lockdowns on risk of exposure to COVID-19 and on income loss. This analysis was designed to produce information that could be incorporated into epidemiological models and also to inform social protection policies. So we created an economic model to illustrate and simulate the equity consequences of national level lockdowns imposed in 6 countries. We chose 2 lower middle income countries, Philippines and Pakistan, 2 upper middle income countries, South Africa and Georgia, and 2 high income countries, the United Kingdom and Chile. We chose these countries because they span a range of country income groups and workforce structures. For each country, we first quantified the number of workers in each occupation by industry using data from the International Labour Organization. We then used local policy documents and news articles from each country to identify the number of workers in each industry that would be identified as essential and allowed to work in person as normal during lockdown. And we also identified people working in activities that were closed during lockdown because all business had stopped. For example, in the entertainment industry or in the restaurant industry. Finally, we estimated the possibility that jobs that were not essential and not closed could be done from home using a teleworkability index based on survey responses identifying things like use of specialized tools or operation of heavy equipment while at work. So using these categories, we estimated 2 possible non-mutually exclusive outcomes for people. First, income loss. So we assumed that people who were in closed activities and people whose job was not essential and not teleworkable faced a loss of income if they were unable to access social protection. Second, we looked at ability to socially distance during lockdown. We assumed that people who were in essential jobs would not be able to socially distance during lockdown. We also assumed that people who had income loss with no safety net in the form of social protection or in the form of access to emergency funds would need to resume some form of economic activity to survive, and therefore would not be able to socially distance during lockdown. We compared the prevalence of these 2 outcomes across socioeconomic quintiles for each population. So moving to our results, if you look at figure 1, you can see that large portions of the population in all countries faced some income loss due to lockdown and or some inability to socially distance during lockdown. This varied by country based on the makeup of the workforce in each country and varying lockdown rules. So for example, lockdown rules in Chile allowed for many more occupations to be treated as essential. As a result, they have fewer people losing income due to lockdown, but more people that are potentially exposed to COVID infection during lockdown. In contrast, in the UK, they had relatively fewer people that were unable to socially distance during lockdown because more jobs were teleworkable. In Pakistan, Philippines, and South Africa, fewer jobs were teleworkable, meaning that higher numbers of people would lose income during lockdown. Looking at figure 2, you can see our sensitivity analysis around assumptions on coverage of social protection had a big impact. Our base case of 20% was taken from phone surveys done by the World Bank across multiple countries, but we didn't have good data on the number of people actually receiving social protection in each country in our analysis. Increasing the availability of social protection has a substantial impact both on the number of people that lose income during lockdown and also on the number of people that are able to socially distance during lockdown. So to conclude, our results underscore the importance of social protection in all settings. Although social protection is typically targeted at the poorer segments of the population, our analysis shows that social protection is really needed across the board. As in many countries, even in higher income quintiles, there are high numbers of people experiencing negative impacts of lockdown. Our results also illustrate the importance of removing barriers to less stringent measures of protection, like testing, tracing, isolation, targeted screening, shielding, and so forth, to limit these negative impacts. So that's all for me. Thanks very much for listening, and I hope you enjoy the rest of the conference.